So welcome to our second ever virtual nursing pinning ceremony, and we certainly hope our last virtual ceremony. We are so proud of all of you graduates. This has been quite the year. Your first year of nursing, your nursing program in the spring was when we went to all virtual, and most now of your second year has been held that way. But you have persevered, you have completed this program. You have likely done things no other nursing student has probably ever done in their program. Many of you have been part of our vaccination clinics. You have treated COVID patients on your clinicals. You have done things that will serve you well in your nursing career. So I wanted to say congratulations to all of you, best wishes to you, and we are so, so proud of all that you've been able to accomplish.
Hello, my name is Amanda Brooks, and I'm the nursing program lead at the Fauquier campus. It's my privilege to welcome from the nursing class of 2021, Fauquier class speaker, Tina Stevick. Tina has been our class representative for 2 years. The students voted on class speaker, and 15 out of 19 students nominated Tina. Tina has been an advocate for her classmates since starting the nursing program.
We all remember the moment when we opened up that email. We remember where we were, what we were doing, who was around, and we remember who we just had to run and tell that moment. I got into nursing school. For some of us, this was a result of years of planning, taking classes to learn how to write better, A&P, where Professor Austin tried to kill us by making us memorize and locate over 500 anatomical parts of the body, and spelling counted. Statistics, oh, they like to call it a math class, but we all know it's really a foreign language and most certainly not math. Microbiology, where we prayed our baby microbes would be happy in the agar and grow. Well, some of us were just happy when we could figure out how to take a picture of the slide through the microscope with our cell phone. It's the little things. Before we realized what was happening, we were sitting in our first nursing school class. 22 people that we may have referred to as classmates before, we thought of as family by the end of the year. The first day of nursing school, it's indescribable. It was terrifying, actually. You may have wondered what had possessed you to think that you could actually do this. Well, you look around and everyone is so smart, so collected, so organized, and there you sit, trembling and contemplating, what have I done? As the days turn into weeks, the humor and the horror that is nursing school unfold, and you realize that everyone feels this way. As the semester wore on, I was reminded by the words of Helen Keller, "Alone, we can do so little, but together, we could do so much." We all had our personal struggles to overcome to be successful. Time with family and friends became limited, and hours we would normally volunteer in our community had to be put on hold till school was over. Some of us struggled with the large amount of reading and retention that was required in such a short time. Sleep, what even was that? Did we remember? Fear of failure and disappointing our family, who had sacrificed so much for us to be here, would almost be too much sometimes. When worry and stress overcame us, we would crawl into our professors' offices, and with their calming words and, handfuls of chocolate, they would assure us we would be okay, we would survive, and in fact, we would rise to the occasion. And I remember one of them, Professor Clifford, who offered to drag us if necessary. Little did we know that halfway through our first year, the world around us would be greatly impacted by a pandemic, and our education would change. An almost immediate transition into online schooling. Labs, clinicals were canceled. Again, had us wondering, what had we signed up for? Will we be able to do this? How are we going to learn to care for patients while we're learning online? And just as before, we came crawling to our professors, this time via Zoom. And like before, they didn't really have specific answers to our questions, but what they had were calming, strengthening words. You can do this. And we believed them, and we did. Spring changed to summer, and Dr. Brooks stepped in to advocate for us. We found ourselves at the front lines of the pandemic, working with contact tracing, and later, when vaccines became available, we administered vaccines at the hospital, first to healthcare workers and later to residents in our community. There wasn't a question of if anymore, but how. Week by week, we all took turns in her Zoom, just waiting for words of comfort, understanding, and strength. She believed we could, and we believed her, and we did. It's the funny moments we all remember, though. For some reason, in lab, we thought it was so important to decorate the heads of the mannequins with seasonal headbands. We had back-to-school ones, Halloween, Christmas. We named each one of them. We created families and couples with stories and drama. We moved them around in the beds according to whatever personal story we had created for that week. Funny things happen as you learn to be a nurse. For example, a head might fall off as you're inserting an NG tube, and the body wash station chain just might get pulled when a bed is moved to practice transferring a patient, soaking the unsuspecting transporter. Or the penis might come off in an attempt to insert a urinary catheter, and then you don't quite know how the sterile procedure to put it back on. Feeding, dressing, and transporting our pretend patient, aka Professor Herbert, was a mixture of hesitancy and hysterics. A nervous student might even make a bed with the bedding in complete reverse order and then tangle everything up in an attempt to right the mess. To great amusement of the professor. "Oh, it's okay, Professor Herbert. I can make a perfect bed now, even around ventilators, wound vacs, IV lines, and central lines." So to that person who was the first to know, we want to say thank you. Thank you for standing by us and encouraging us, for bringing us food when we were hungry, for driving us to class and labs and clinicals, for washing our scrubs so we could fit in a few more study questions or review another case study. Thank you for understanding when we couldn't attend that gathering, when we were too tired to engage in conversation, or all we could talk about was a procedure we were mastering, or concepts we were trying to grasp and matter. Thank you. We made it. We are baby nurses, ready to change the world of medicine by our commitment and passion to provide the very best care and advocacy for our patients. Thank you. We appreciate you.
Hello, my name is Christina Simpson, and I am the Director of Health Professions here at LFCC and the Acting Middletown Program Lead. It is my privilege to welcome from the nursing class of 2021, the Middletown class speaker, Chad Goffrey.
Hello, class of 2021. For those of you who I have not met in person, my name is Chad Godfrey. I'm honored to speak on behalf of our Middletown cohort. I want to personally thank and congratulate all of you on your successful completion of this incredible journey. What a ride it has been. For some of you, this is your first college experience. Others, like myself, took a bit longer to discover nursing. Regardless of our backgrounds or the paths that we traveled getting here, it is our calling to care for others that unites us. I had previously served in the United States Army, where I formed a strong bond with those I served with and considered them family. I feared that I would never find anything quite like that again. However, the bond that has been created, even early in nursing school, is above and beyond anything I could have ever hoped for. The support, love, and acceptance has brought us all together in our own family. I'm so proud of us all. There have been many ups along the way. Getting our acceptance letters, remember that? Welcoming us to the nursing program at Lord Fairfax. Meeting so many great students, faculty, nurses, and patients along the way. And finally, completing what might have been the hardest thing we have all done in our lives. But that did not come without one tiny little speed bump. And yes, that speed bump. The world was changed with the pandemic, and hospitals were forced to shut their doors to students while they raced to convert to COVID treatment facilities. While this could have discouraged us from completing nursing school, it did not. In fact, it highlighted the determination, the courage, and adaptability we all possess. But it wasn't just us. We have our faculty and hospitals to thank for working tirelessly to ensure that we could reach our goals. I will never forget how this pandemic has shaped nursing as a whole, and it has shaped each and every one of us for the better. So I say to you, my fellow nurses, don't ever lose sight of where you came from, while each of you pave your own path as registered nurses. Robert Schuller said it best when he wrote, "Tough times never last. Tough people do." So stay tough, class of 2021. Of course, I want to extend a huge thank you from the nursing students to our professors, clinical instructors, preceptors, and staff. It is safe to say that without their dedication to us, we would not be where we are today. To Professor Marshall, thank you for showing us sometimes it's the little things that matter the most. We will never forget what phlebitis or phlebitis is. To Professor Regula, thank you for ensuring we nailed the basics and made everything as clear as mud. To Dr. Williams, thank you for navigating us through the complex concepts of nursing, even if we didn't select all that apply or choose the most correct answer. To Professor Habermail, thank you for your kindness and for preparing us for the exciting world of healthcare policy and economics. To Professor Payne, thank you for preparing us for our final transition out of nursing school and for not being an actual professor of pain. To Mrs. Katz, thank you for keeping us straight, and we promise to never send you another email. Maybe. Lastly, to Professor Simpson, thank you for your interest in each of us and for teaching us the ways of APA and for also letting us cry and eat chocolate in your office. I don't think that anyone is ever completely prepared for leaving nursing school. The program has been our safe haven, surrounded by family and supported by mentors. But this is the beauty of nursing. Things are always changing, and we will continue learning as we head off to our respective fields. You are all going to do amazing things. And just remember that if your dreams don't scare you, they're not big enough. I'll leave you with a quote from the great Bill Murray, as I think it applies to each and every one of us, who said, "Whatever you do, always give 100%, unless you're donating blood." Thank you, congratulations, and good luck, nurses.
Before we talk about the outstanding graduate, I want to describe what nursing school is like. Most nursing students enter nursing school with straight A's. Graduating nursing school with straight A's or even high B's is very difficult. There are some general education classes included in the nursing degree, but most classes are nursing classes. Students progress from learning what a nurse really does and learning the foundational concepts in nursing to applying those concepts and many others to complex health conditions. The test questions increase in difficulty, taking students from applying knowledge to applying knowledge in a situation after careful assessment. These students also become experts in selecting all correct answers that apply and in choosing the most correct out of 4 correct answers. While in nursing school, the nursing classes, labs, and clinicals are at least 4 days a week each semester. There are tests almost every week, as well as care plans, papers, and projects. There is a minimum of 500 clinical hours over the course of the nursing program. Students are advised to limit commitments outside of nursing school to no more than 20 hours a week, when possible, because of the academic load. On top of all of this year's graduating class had to deal with the coronavirus. After a pretty routine first semester, this class was thrown into an academic environment affected by a worldwide pandemic. Almost overnight, clinicals were canceled and face-to-face instruction went online. We all became Zoom experts, and many students took advantage of gaining clinical experience as contact tracers and interpreting CDC guidelines. Students continued their experience with administration of COVID vaccines in the community. The Outstanding Graduate in Nursing is an award that recognizes the nursing student with the highest GPA, calculated using grades earned in their nursing courses only. The general education classes are not factored into this GPA. At Pinning, we honor the students who graduate with the highest GPA in their nursing courses. To earn the award of Outstanding Graduate, a student must have a GPA of at least 3.75. There have been years when there is not a student who earns an Outstanding Graduate Award. Last year, there were 3 students who had a 4.0. This had never happened before. We didn't expect it to happen again, but it did. In spite of the challenges related to nursing school in a pandemic again, the Fauquier campus has 3 students graduating with a 4.0. These students have been mentors to their classmates, have juggled family, school, work, and volunteer time, and are always willing to lend a hand to their fellow classmates. The students at Fauquier graduating with a 4.0 in their nursing classes are Stephanie Hoschauer, Colleen Manfrey, and Tyler Willis. Stephanie and Tyler are traditional nursing students, and Colleen is an advanced placement option student, meaning she was an LPN who returned to school to get her RN and completed the program in 3 semesters. Congratulations.
Anyone who has been through nursing school knows that much of it is about managing expectations. Very few people will graduate with straight A's. Perhaps that is why it is so unprecedented that we have 4 students at Middletown graduating with a 4.0. Donna Kelly, Frances Atangan, Emma Delaney, and Christopher Williams are all recipients of the Outstanding Graduate Award. Each of them have contributed in immense ways to their cohort and to their personal and academic growth. They have demonstrated professionalism, conscientiousness, critical thinking, and above all, determination to overcome obstacles. They have been leaders and have gone above and beyond to ensure their success, both in the classroom and the clinical settings. Congratulations to each of you, and welcome to the profession. The winners of the next 2 awards were nominated and voted upon by our clinical and full-time faculty team. Mary M. Roberts was a member of the Army Nurse Corps in World War I. She wrote many articles about nursing and nursing education. She describes the spirit of nursing as one of the most indestructible elements in the lives of those who possess it. She goes on to say that the spirit of nursing is made up of courage, kindliness, fidelity, sincerity, compassion, and benevolence. The Spirit of Nursing Award goes to the student who regularly went above and beyond. At Middletown, we would like to recognize 2 such individuals in our program, one from the traditional pathway and one from the LPN to RN, or advanced placement option. We still remember the day that this student walked into the classroom on his first day of nursing school. He carried himself as a leader from the beginning. He collaborated with his peers to set up communication strategies and was actively engaged in each and every lecture. He consistently demonstrated his commitment to learning. Regardless of the situation, he approached challenges with a positive attitude and the determination of one who has already mentally won the battle. Never once has this student deviated from a course of action that would allow him to provide optimal patient care. He is open to criticism and brings his robust life experiences into both the classroom and his clinical experiences. His peers have relied on him over the past 2 years, and he has stepped up to meet all expectations. Not only do we thank this student for his service to our country, but we thank him for the multitude of ways he has selflessly devoted time and energy to others throughout his time at LFCC. Congratulations to Chad Goffrey. We know you have a bright future in nursing. The Middletown Spirit of Nursing recipient for APOs has been an absolute pleasure to have in the classroom. He is bright, conscientious, and caring. Despite already having a nursing license as an LPN and actively using his nursing skills, he never once let that tarnish his desire and attitude toward learning and achieving the next steps of his nursing academic journey. This student has carried a heavy night shift work schedule throughout nursing school, but one would never guess by his grades and engagement in his studies. He has been meticulous in his work and has consistently offered a positive and caring attitude in every interaction. Congratulations to Francis Atangan. You exemplify all that it means to be a nurse, and we look forward to seeing the many ways you will contribute to the future of nursing.
At Fauquier, the Spirit of Nursing Award recipient is Michael Williams. Michael started nursing school after serving our country as a Marine. He's very quiet in class, but shines in clinical. His assessment skills and bedside manner are exceptional. In clinical, he has often identified changes in a patient before the primary nurse does. He's faced some challenges during the nursing program that would have made many students withdraw and return at a later date. Michael never complained and refused to allow them to interfere with attending class or clinical. He addresses everyone as sir or ma'am. He has such a gentle, caring approach to patients. The elderly patients absolutely love having him as their nurse. Congratulations, Michael. We look forward to your future. Nursing school is a time of huge personal growth for all nursing students. Some students start nursing school with a background in healthcare, and others come with many years of life experience. Some come with the idea that they want to help people, but don't have the confidence and the experience to be comfortable with what they're exposed to while in school. In every class of students, there are those who are first in line to try a new skill or experience something new. And there are those who are hesitant and unsure, the students who need to gain confidence in themselves and in their abilities as a nurse, and students who have to work hard to go outside their comfort zone and learn a difficult skill. This year, the Fauquier campus has voted for Irene Burrow. Irene immigrated from Kenya 10 years ago. English is not her first language, and suddenly she had to learn everything about her new profession in this unfamiliar language. Terminology was new to her, and she struggled with understanding complex ideas presented in English. She struggled with reading through test questions and had to work hard to process information that was not presented in her native tongue. Irene spent many hours in the offices of her professors in her first year. As the semesters flew by, Irene demonstrated a firm grasp of nursing knowledge and began to shine in clinical. Irene completed a preceptorship in pre-op, and for her evidence-based practice project, she focused on how to reduce stress in patients waiting for procedures. Her preceptor was very impressed that she had recognized the need for this while finishing up nursing school. Congratulations, Irene.
Nursing school can be intimidating, and many students enter it with a measure of uncertainty. When this student came to us, she presented as quiet and maybe even shy. And like so many, she lacked confidence in her skills and abilities. Perhaps that is why it has been such a pleasure to see the transformation she has experienced during her time at LFCC. We have watched her transition to a well-spoken, confident, and passionate nurse and patient advocate. Her knowledge and quality of patient care is exceptional. She performs well in the classroom and clinical setting. We are extremely proud of her for all that she has overcome and accomplished. Congratulations to Gabby Patira, and welcome to the profession. Our APO nursing students are a very special population. Many have been nurses for years, and it takes a lot of courage to re-enter the academic world and pursue the next step of their academic journey. When this student stepped into her first APO class, she sat in the back of the room, and she quietly engaged in learning. But as she progressed through the program, we watched her open up and blossom. And as if nursing school was not challenging enough, this student received an unexpected surprise and endured a challenging pregnancy and birth while in the program. It might have understandably derailed another's progress, but this student demonstrated her determination through it all. She persisted and accomplished her goal of completing her AAS. Congratulations to Shandy Stanford. You are a shining example to all of us, and we look forward to seeing all that you will become. The nurse's pin traces its roots to the Crusades of the Middle Ages. During the Holy Wars near Jerusalem, wealthy men who went into battle would hire a personal nurse to come in with them and take care of them in case they were wounded in battle. In order to avoid being attacked, these nurses would emblazon a large red Greek cross on their blue tunics or capes. While all these hired nurses were in Jerusalem, they formed the first hospital and organized a nursing group. The hospital and their order were called the Order of St. John. They used the Red Cross to denote their order, and later, the International Red Cross adopted this symbol. Later on, during the Renaissance, the various craftsmen guilds decided to hire nurses to take care of their own as they aged and grew infirm. Each craftsman's guild would develop an emblem to identify its group, and they wore this emblem on some kind of pin or other jewelry. The nurses they hired began to wear the guild's pin to identify which guild they served. When Florence Nightingale formed modern hospitals, the hospitals adopted distinct pins to give their graduates when they completed nursing school from their diploma programs. In the workforce, nurses would wear their pins so everyone could identify the nursing programs from which they graduated. The Red Cross was a very common emblem on the pins. And still today, it is frequent to find some variation of the Greek cross on the pins of nursing programs.
It gives me great honor to recognize the Lord Fairfax Community College nursing class of 2021 at the Fauquier campus. Congratulations, guys.
It gives me great honor to recognize the Lord Fairfax Community College Nursing Class of 2021 at the Middletown campus. In 1893, Lystra Gretter led a committee in Detroit, Michigan at the Foran Training School for Nurses. Together, they created the Nightingale Pledge. Inspired by the founder of modern nursing, Florence Nightingale, Gretter so named this pledge because she considered Nightingale to be the moving spirit behind the idea for the pledge. Physicians recite the Hippocratic Oath, but nurses recite the Nightingale Pledge. It is a statement of ethics and principles and has been used in pinning ceremonies for decades. I invite all nurses who are listening to join us now to recite this time-honored pledge together. I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. I will abstain from whatever is deleterious and mischievous, and will not take or knowingly administer any harmful drug.
I will do all in my power to maintain and elevate the standard of my profession, and will hold in confidence all personal matters committed to my keeping,
and all the family matters coming to my knowledge in the practice of my calling.
With loyalty will I endeavor to aid the physician in his or her work,
and devote myself to the welfare
of those committed to my care.